So how did the financial health poll go for you? Well, I have the results, and it's a little like a doctor's visit. I've got good news, and I've got bad news. The good news is that most of you are among the 43% of Americans who are financially healthy. The bad news is that the majority of the country and of your customers are not. CFSI has been introducing this idea of financial health over the last several months and spreading the news about just how financially challenged Americans find themselves today. You see, last year, with the support of American Express and the Ford and MetLife Foundations, we took a snapshot of the state of financial health in this country, as Karen just mentioned. And we found that 57% of Americans are struggling financially. So what does it look like to struggle financially? What does that mean? Well, according to our snapshot, about a third of the country says that if they had a sudden drop in income, they could only make ends meet for 3 months or less. A quarter of Americans say they've saved less than $1,000 for retirement. Another 43% say they struggle to pay their bills and to repay their debts. I could go on with these statistics. I think we're regularly assaulted with them daily in the newspaper. And I think at this point, we have a pretty good handle on the symptoms of poor financial health. The question I want to talk about with you today is, how do we design the best treatments? And in order to answer that question, first we've got to get really clear on the diagnosis. So when we talk about financial health, what do we mean? Well, we believe that financial health comes about when your daily systems help you build resilience and pursue opportunity. Now, build resilience and pursue opportunity are really just fancy ways of saying avoid your fears and achieve your dreams. And the daily system, that's just the combination of the products you use and the choices and decisions you make every day. And it's that daily system that either helps you or hinders you on your financial health quest. Think about it this way. It's awfully hard to amass savings or to build and maintain a good credit score if you have trouble paying your bills every month, you're drowning in debt, and you're stressed out about money. Building resilience and pursuing opportunity is nearly impossible without a strong, healthy daily system. So what does a strong, healthy, day-to-day financial system look like? Well, you should be able to answer yes to all of these questions. Do you have access to financial services and advice? Do you have more money coming in than going out? Do you pay on time? Can you handle your debt load? Are you aware of your financial situation? Do you plan ahead for large, irregular expenses? Do you have a manageable level of financial stress? Are you confident in your ability to meet your short-term goals? And are you satisfied with your current financial condition? It's clear from this list that all of us in this room are a significant factor in the options people have and the actions they take. And in fact, there's a business opportunity in improving those options and helping to guide the decisions that consumers make so that we're improving their day-to-day system and increasing the odds of their achieving financial health. But it's the how that's frankly hard. How do we build businesses that help consumers answer yes to more of these questions? Let's not forget, though, we have a blueprint already. Let me take you back to the months just following the financial crisis. It was a time when Americans had really lost faith in banks. And the idea of financial innovation was thought to be nothing more than a way to make more money off the backs of people who could least afford it. Now, CFSI was built on this idea that financial innovation could be good, could be a force for good in people's lives. And in that moment, we were really concerned that no one was going to buy our fundamental premise. And we realized that we needed to do a better job of defining how financial innovation can be good. And that realization led us to create the Compass Principles. These should look familiar to you. Embrace inclusion, build trust, create opportunity, and promote success. We created these together with all of you as a guide for designing and delivering the kinds of high-quality financial products and services that help people get healthier. The question is, how do we put them into action? In order to do that, we've got to breathe life into them. We've got to really get to know and understand deeply the consumer, to walk in their shoes. Because to design effective treatments, we have to get inside the minds and the checkbooks of Americans to understand the choices they have and the decisions they make. We need to know where the money comes from, where it goes, how it flows, and how it makes them feel. And that's exactly what we've been doing through the U.S. Financial Diaries Initiative. The Financial Access Initiative at New York University approached us and teamed up with us several years ago to study deeply the financial lives of about 200 families living in these 4 diverse communities across the country. The work is led by Jonathan Morduck, an economist at NYU, and our very own Rachel Schneider. And you'll be hearing more about the most recent results throughout the conference. So here's how this initiative worked. Every 2 to 4 weeks, we sent field workers to visit with these families and to document literally every dime that moved in and out of that household and the underlying issues and decisions that drove those flows. It was an incredible undertaking. You can imagine just how time-consuming and painstaking that work was. And so it's why we're especially appreciative of the Ford Foundation, the Citi Foundation, and the Omidyar Network for investing $5 million over the last 5 years in this path-breaking work. I've been reflecting lately on just how much we've learned from this work and how helpful it is in truly understanding what's going on in people's lives. Really helps with the diagnosis. And it made me start to think about that old TV show, House. Do any of you remember that show? TV show, House? This should remind you. It starred Hugh Laurie as a curmudgeonly doctor who was addicted to pain pills, but who was also an expert diagnostician. In every episode, a new patient would show up at the hospital with some mystery illness, and House and his team of doctors would have to, with the clock ticking, figure out the diagnosis and help treat the patient. My favorite episodes were when House would send his young team of doctors out to the house of one of these patients to try to understand what was making them sick. They would rifle around through the medicine cabinet and the refrigerator. They would go through the trash, and they would bring back everything they found to the lab. And with moments to spare, House would make a terrific diagnosis and treatment would begin. So that's what we're going to do here today. I want you to try out your own diagnostic skills here with me. I'm going to introduce you to the Johnsons, one of the families that we interviewed as part of the diaries. It's not their real name, of course, and these photos I'm going to be showing you are illustrations. And we've changed a number of details, a number of small details about their lives so that no one can recognize them. But their situation is real. I'm going to take you deep inside their financial lives, and as I do so, I want you to keep in mind the checklist I put up just a few minutes ago. I want you to think about how the Johnsons stack up to that checklist. I want you to jot down your thoughts about what your diagnosis is. And in a few minutes, I'm going to ask you for your input. And I have been known to call on people. So do jot down some of your thoughts, okay? So the Johnsons, they live in Ohio, in a small town outside Cincinnati. Sarah is 38, Sam is 49, and this is a second marriage for both of them. Sarah is a full-time HR administrator, and she works part-time as a secretary. Sam sells electrical equipment. He coaches sports on the weekends, and he also works a weekend job at a call center. Together, they're raising their 8-year-old daughter, Amy, and 2 children from a previous marriage. Matthew, who's 20 and is a full-time student living at home with them, and Anne, who lives with them part-time and is getting ready to move out. Now, if you look at the Johnsons' tax returns for the year, they look like they're doing pretty well. They have multiple sources of income, and they're bringing in about $55,000 to $60,000 a year, which is above the median in the US. They own a house and 2 cars. They have a 401k and employer-sponsored health insurance. They are able to spend money on clothes and entertainment, and to celebrate the important milestones in their children's lives. But their pay stubs tell a different story. On a monthly basis, their income fluctuates dramatically from anywhere between $4,100 to $9,000. What's going on there? Why is that? Well, for one thing, for part of the year, Sam only earned 2/3 of his pay because he was on disability, recovering from foot surgery. Sam and Sarah's part-time jobs both pay irregularly. Sarah and Matthew are both getting college degrees, and so they have financial aid coming in, but that aid only comes twice a year in very large lump sums. And Sarah's ex-husband is supposed to be paying child support, but he only pays it sporadically. It's also important to look at the dates on those pay stubs. You see, Sam gets paid every other week, and Sarah gets paid at the middle and end of every month. Now, sometimes that works out just fine, but other times, just because of the vagaries of the calendar, all of the money seems to come into the house at once, creating a significant timing mismatch between when the income comes in and when their bills are due. Sarah is the money manager for the household, and she has a pretty straightforward system. Each paycheck goes to a different bill. So paycheck number 1 goes to the mortgage. They owe a little over $70,000 on a house they estimate is worth $92,000. And paycheck number 2 goes to the car payment. Whatever's left over is supposed to cover everything else. She only authorizes 3 automatic payments from her checking account, 1 to Netflix and 2 for the car insurance premiums. Everything else she pays via online bill pay in a just-in-time fashion because she wants to make sure that the money is going to be there. But the system isn't foolproof, and there have been a couple of times where they've had the lights or their phones cut off for failure to pay. To make matters more complicated, their expenses are as volatile as their income, maybe even more so, ranging from $4,600 to $11,000 in the month of September over a 7-month period. What happened during that $11,000 month? Well, the Johnsons bought a new car because their old car was unreliable and they really count on it to get to work. And then, as luck would have it, they got a leak in the roof. And the leak caused water damage in the house. It ruined some rugs and furniture. And this, in turn, exacerbated their daughter's asthma. So in addition to having to repair the roof and replace the rugs and furniture, they also had to buy an air purifier. This isn't an isolated incident. As much as Sam and Sarah are incredibly proud homeowners, the house is not in great shape, and they've frankly struggled with upkeep and maintenance. It's also not in a particularly great neighborhood, and they've had some bicycles and some odd machinery stolen out of their yard. The Johnsons also have their share of health problems. Sarah had a CT scan and then had her appendix removed. Sam had that foot surgery I mentioned. One of their daughters had another medical procedure. Matthew has a chronic illness, and he had an emergency room visit. I could go on. And as a result, despite having employer-sponsored health insurance, they owe $8,300 in past medical debt. And given all the other stress and strain in their finances, they owe another $3,000 across 7 different credit cards. When you ask the Johnsons, what's your greatest financial aspiration? Their answer is to be able to pay our bills on time. The Johnsons are clearly hardworking, but something's not working. Usually we just assume it's an income problem, But in the Johnsons' case, that doesn't really quite seem to nail it. Look how they stack up against the checklist. They can only answer yes to 2 of these questions. They certainly have access to financial services. In fact, some might say they're overbanked. And they are extremely aware of their financial situation. They're actively trying to manage it. They're just not always succeeding. Okay, you're back on the set of the TV show House, Financial Health Edition. We've dived deeply into the Johnsons' financial lives. So what's the problem? In a word or 2, tell me your diagnosis. Let me see some hands, particularly from those in the front so I can hear your answer. What are you seeing that's not working? So the timing of their bills versus their income is a problem. She said maybe they need to restructure the timing of when their bills are due. Good. What else?
Sounds like they need some more set-aside funds for the emergency, like the roof leak and whatnot.
So more savings so they can be planful for the roof leak and other kinds of unexpected expenses. Good. Anything else? Thank you. Over-indebtedness. Maybe they've taken on too much debt, or maybe they're spending too much. What else? The clock is ticking, people. They may need to reduce the amount they're saving in their 401k in order to get a better handle on their day-to-day expenses. Any others? Say again. Divorce is expensive. Very true. Let's hope this one sticks. One more, maybe? Insurance products, right. They have health insurance. Is it really working for them? Good. And home insurance, sounds like. Yes, good point. That's actually a good question. We should look at that data. So remember now, when the doctors on the TV show are done gathering all this data and evidence, they bring it back to the lab to analyze it. And that's exactly what CFSI has been doing. We have taken everything we know about the Johnsons and people like them, and we've brought it back to our lab, the Financial Solutions Lab. The lab is a virtual community of fintech startups, more established financial services providers, and nonprofit organizations who are committed to building solutions to improve financial health in America. We capitalized this lab with $30 million from JP Morgan Chase, our founding sponsor. And we're putting that capital to work by organizing a series of challenges to energize the next generation of entrepreneurs to hack financial health. And so when we launched the lab last year, the very first thing that we did was we put the Johnsons under the microscope. And the thing that popped out at us as being one of their most significant problems was the ups and downs of their income, the uncertainty of that, and the cash flow challenges it created. And so in February, we launched a challenge looking for providers who were creating solutions to reduce income uncertainty and smooth cash flow. It may not be the Johnsons' only problem, but it's a big one for them and for millions like them. In fact, recent research shows that about a third of Americans suffer from this uncertainty of incomes in a significant way, and despite the fact that more than half of them are employed full-time. So we put out this call, and the response was overwhelming. We saw dozens and dozens of great ideas that spoke in many ways directly to some of these challenges that we just diagnosed with the Johnsons. So for instance, on this issue of the ups and downs and the uncertainty of their income, we saw a whole host of solutions trying to address that. For instance, one is active hours. Active hours lets users draw down pay that they have earned but not yet received. I mean, think about it when you get your paycheck, right? You're being paid for work that you've already done. So imagine that Sarah sees that she's got a bill coming due on a Wednesday, but payday isn't until Friday. With active hours, she could draw down the pay that she had earned so far on, say, Monday, and still be able to pay the bill on time. One of the other reasons for the ups and downs of their income is the child support issue. The divorce is expensive issue. A tool that we came across was Support Pay. It's an online platform that lets divorced parents track and manage child support expenses and make automated payments, even partial payments. So for Sarah and Sam, it could amount to more money coming in every month, but at the least, it might amount to more regular income coming in every month. And it also has the potential to reduce the stress that Sarah feels in having to deal with her ex about money. One of the other issues I think someone raised was about the mismatch in timing between their income and their bills. We saw a lot of solutions focused on bill payment. As an example, one is called Prism. It's an app that allows consumers to track, manage, and pay all of their bills for free, real time. It displays your bills in a calendar format so you can visualize what's due when. It lets you check your balance in your banking account to make sure that you have the money available, and it will even send you a notification if paying a bill is going to cause an overdraft. Imagine for Sarah how helpful this would be in helping her optimize when to pay which bills and to stay on top of them more systematically. Because of all this uncertainty, it's been very difficult for the Johnsons to put aside money, as someone mentioned. But our research shows that people who plan ahead for large, irregular expenses, like a leaky roof or a new car, are 10 times more likely to be financially healthy. And so we were really pleased to see a number of applicants focused on helping people put aside small amounts of saving. One that I'd like to share with you today is called Saved Plus. Saved Plus is an automated savings platform that moves money between people's checking and savings accounts every time they spend money. So Sam and Sarah could register their debit and credit cards with Saved Plus. They could set an automatic savings percentage, and then Saved Plus would monitor their transactions, and every time they made a purchase, it would apply that percentage and put aside the savings into an account. It was incredibly difficult to narrow down this incredible pool of applicants to the final 14, who we announced about a month ago. Most of them are here at the conference, and I would strongly encourage you to seek them out and to learn more about what they're doing. Now, we're going to announce the winners tomorrow up here on stage. We're very excited about it. But regardless of whether you applied to be part of the lab or not, everyone in this room has a role to play in improving financial health in America. The Johnsons are all of our customers, literally. They have a checking account and 7 credit cards and a mortgage and 2 car loans. They have a 401k. They have health insurance. They use online bill pay. They have a system. It just doesn't work for them all the time. And no one company or organization in this room can meet all of their needs or fill all of the gaps. We're experiencing a massive unbundling in financial services right now. Consider all the solutions I just described. They're all single product offerings that are trying to solve for one symptom, one problem. But the Johnson story demonstrates that consumers need help knitting together the various products and solutions that they're using into a single holistic treatment plan, if you will. Because people don't live their financial lives piecemeal. It's all interconnected. And so we must be interconnected. CFSI has worked hard over the last few years to forge those interconnections. And we made those efforts more formal earlier this year with the creation of the CFSI Financial Health Network. So far, we've invited 72 companies to join the network and take a more active role in leading this financial health movement, debating, piloting, inventing the best approaches for making America more healthy. But there are over 300 companies and organizations in this room today. And we want to be working with all of you, and not just at Emerge, not just at this conference. And so today, I want to invite you to join the CFSI community. It's a way to engage year-round on these issues with us, with the kind of data and insights that you need to build the best treatments for your customers, and with the other companies and organizations that you need to partner with and learn from on this financial health journey. We'll be opening up the community later this fall. But to learn more now, just click the sneak peek button that was in your daily forum guide that you received in your email this morning. It's fun to pretend that we're on the set of a TV show, diagnosing the tough cases and coming up with the right treatments. But what we're talking about here is not a TV drama. We may have changed their names, but Sam and Sarah Johnson are real people. So's Lauren Walker, a single mother raising a 4-year-old son in eastern Mississippi. So are Ahmed and Shayla Hussein, Bangladeshi immigrants making their way in a new life in Queens, New York. So's the Rodriguez family, an intergenerational household living outside San Jose, who are one crisis away from upending their upward trajectory. These are just a few of the people that we happen to interview as part of the US Financial Diaries. They represent millions more across the country. Maybe they remind you of someone you know. The admin in your office, or the nanny caring for your children, a sibling perhaps, or a friend. They also represent the majority of your customers. Now, CFSI has been preaching this message for over a decade now. But the US Financial Diaries now enables us to put a face on the symptoms, to more accurately diagnose the problem, and to begin to design the best treatments. And that's what I'm calling on you to do now. Because I can assure you, your customers do not need a second opinion. What they need are the kinds of high-quality products and services and advice that are going to help them on the road to financial health, today and every day. And they're counting on you to make it happen. Thanks very much.